Difficulty with the vaccine delivery, difficulty with mandatory quarantine as well. Department of Health announcing they've paused taking bookings as a precautionary principle. There's a problem with walk-ins at the hotel, people turning up without booking online before departure. Sinn Féin Health spokesperson David Cullinan joins us. David, what do you make of these issues that have arisen surrounding capacity at the hotels?
Well, good morning, Shane. First, I think it's a shambles, to be quite honest, and it's all a result, in my view, of a lack of planning. It's that plain and simple. 10 months ago, NPHET advocated that the government should explore mandatory hotel quarantine. Since then, on several occasions in writing and at meetings, they have asked again and reiterated their concern that mandatory quarantine was not in place. They have consistently said that it is one of the ingredients which is necessary to give this state the highest level of protections against any new variant. So they've been very strong on that. And I think that lack of planning and the pushback by government for the last 10 months has resulted in them rushing into this, not planning, not putting the infrastructure in place. And then we see that we don't have the capacity. And I think the government has to take responsibility for that.
Now, the capacity, we should say, is going to go up. The capacity is going to go up. 650 rooms at the moment. It's going to go up to 959 by Monday and 1,147 rooms by April 26th. They are increasing the capacity.
But the capacity should have been put in at day one. The Department of Transport and the Department of Health would have had all the information in relation to the numbers of people who have been travelling into this state for the last.
No, it's a fair point, David. I suppose the counter argument is last Friday there was only 56% capacity. There was only 56% of the rooms were full, and that what has changed things is the addition of extra countries to the list, and then they're reacting to that by increasing the capacity now.
Well, Shane, we can make excuses for the government, but the government are the ones that added those countries to the list, and their modelling would have showed them that more people obviously will need to use the mandatory quarantine because of countries being added to that list. And I don't think it's good enough to say that, well, next Monday and in 2 weeks' time we'll have more capacity. We have a situation right now where the process has to be paused because we don't have the capacity. Now, if you listen to what Dr. Ronan Glynn said yesterday at the Health Committee, he said two very important things from my perspective. One, he struck a very positive tone and struck a very positive message in relation to what was possible in the next number of weeks. And he said if we abide by the existing restrictions and if the government gets all of the measures right over the next few weeks, we have real opportunities in the summer months to substantially ease restrictions. That's what I want to see happen.
Okay.
He also said that if we get it wrong, and he mentioned mandatory quarantine as one of the ingredients which is needed to keep out new variants which are of concern to public health experts, then we risk undoing all of the good work that has been done. I don't believe we should take that risk. I think we need to listen very carefully to the public health advice, put ourselves in the strongest possible position, and hopefully, as we get to June, we'll be in a much stronger and a much better position to ease restrictions, which is what we all want.
Just before you go, on the actual vaccines, do NIAC need to reconsider their position in relation to the AstraZeneca vaccine after what has emerged in relation to Johnson & Johnson? Is there a need, I don't know if you heard the conversation we were having earlier, is there a need maybe to have less caution in how we proceed in terms of giving the vaccine and accepting there is an element of risk, but that risk is lower than the risk from COVID?
Well, I think, Shane, this is a big challenge, and when you say less caution, I think that would concern some people. So,
of course, absolutely, I don't deny it.
Yeah, and I think the last people who should make decisions in relation to what vaccines should be used and for what cohort of the population should use them are politicians.
Okay, fair
Politicians
enough.
have to listen to the experts. The experts are NIAC. Of course, there are people who will have different opinions than other experts. But what you have NIAC set up where you have a range of experts, I'm sure there is different opinions within that organisation, but they reach a conclusion, they make a recommendation, and I think that it is the right thing to do to put safety first. But of course, it's a setback. And what we now need to hear from the HSE is that they can mitigate against this and ensure that it doesn't delay the overall rollout, which is obviously what will concern people.
We'll leave it there. Sinn Féin Health spokesperson David Cullinan, thank you for talking to News Talk Breakfast this morning.